Can you have a seat up on the table for me? I'll take a listen to you.
When doctors take the Hippocratic Oath, they swear to do no harm. But according to Berwyn cardiologist Dr. Charles Kinder, that's exactly what they do when wearing traditional coats and scrubs which can carry bacteria. After one of his patients died of a hospital-acquired infection in 2009, Kinder's investigation led him to entrepreneurship. The idea? To make antibacterial coats and scrubs, the company now dubbed DocFroc.
I had no idea I'd end up trying to do this, and this really runs from the same passion I have for taking good care of patients. I've done more than 7,000 heart rhythm operations. I have very low complication rate, and every time I do have a complication, which is rare, I feel it's my duty to figure out what went wrong and how to do better the next time.
Kinder shared his patient's story after a workout at the East Bank Club with fellow member Jerry Levy, who just happened to own a textile factory in North Carolina and has supplied fabric for VA hospitals.
Satin back coat.
Levy had his own story to tell. His mother-in-law got a staph infection while in the hospital to repair a shattered elbow and died shortly thereafter. The two joined forces on DocFroc. Kinder developed a new design for the doctor's coat with features like a stethoscope holder, Velcro pockets, adjustable waistbands, and pager pockets. Levy worked on the fabric, finding a silver-based antibacterial coating. One challenge, making the samples.
Today, you can count the contract sewing shops in the South on possibly one hand. So what I had to do is go out and find a contract sewer down towards the Outer Banks who already makes scrubs, knows how to facilitate scrubs, and put that together.
But perhaps the biggest challenge so far has been convincing hospitals and individual doctors, nurses, and other medical professionals to pay around twice the amount for traditional coats and scrubs. DocFroc coats cost $70, scrubs $45. And there are few studies definitively tying lab coats and scrubs to the infections that kill nearly 100,000 patients in the United States every year.
That's more than a 747 airline crashing every day. If that were happening every day, people would be up in arms about we have to do something. This is a major problem in the healthcare industry, and we need to draw attention to it.
Dr. Chuck BAREIS is the chief medical officer at MacNeal Hospital in Berwyn, where Kinder practices. The hospital is providing DocFroc coats to its doctors in training.
Hospitals are trying to reduce their costs nowadays rather than increase their costs. However, if you look at it in the total context of some of the healthcare reforms coming down the pike with Medicare and probably other insurers not reimbursing for hospital-acquired infections, I think more and more hospitals and more systems are going to be taking a really close look at antimicrobial clothing.
Doctor attire has recently come under scrutiny. In 2009, the American Medical Association studied a proposal to adopt a dress code because of concerns about germs. That was after the British National Health System adopted a bare below the elbow policy. No long fingernails, ties, hand and wrist jewelry, and no lab coats. DocFroc sales have been running about $3,000 per month since last July. Kinder and Levy have been funding the company themselves, but are currently looking for $600,000 to expand outreach efforts and to build out the product line with more scrub colors and designer versions. DocFroc also has a $5 million midterm funding goal, which Kinder says would help consolidate the production process and keep it in the United States. But he acknowledges that competition will come in the form of the market's big players that could eventually put him out of business. But he's okay with that.
Even if we go out of business, but we force the major players in this industry to make robust antibacterial garments, we'll feel like we've succeeded, because our goal really is that we identified this problem, we've identified a solution, and if this changes how the country thinks about prevention and prevention of hospital-acquired infections, then we'll feel that it was a victory.